Hello everyone, myself Shreyas Ravindra Patil. Today I am going to discuss about the EdCom module, the relationship between cost of treatment and patient complaints. So let's understand about the term cost of treatment. We can categorize the term cost of treatment into three parts. Those are development expenses, financial burden, and pharmacoeconomics. What does development expenses mean? It is reasonable to include overall expenses of the development of the drug, but excessive spending on advertising and incorporating it into the drug's price can be unjustified. Secondly, financial burden. We all know that many high priced drugs are unaffordable for many patients, so it is the responsibility of the clinician to consider the price in promoting or discouraging drugs based on scientific justification. And thirdly, pharmacoeconomics. So the term pharmacoeconomics compares the cost of different therapeutic approaches against the outcomes of that particular drug. It includes various types of analysis such as cost minimization analysis, cost effective analysis, and cost benefit analysis, and cost utility analysis. Now let's understand about the term patient compliance. So the term patient compliance means the consumption of medication as per the advice of the clinician, that is, adherence to take the drugs as prescribed by the clinician. So, patient compliance is the extent to which a patient follows instruction for a particular medication for a particular disease. Patient compliance may be complete, it may be partial or total compliance or erratic compliance, and it can be also over compliance. Failure to follow the instruction for medication is non-compliance. It is a major factor in therapeutic failure, both in routine clinical practice and during clinical trial. So, what are the factors that affect the patient compliance? They can be categorized into three parts. Those are financial factors, non-financial factors, and other factors. Firstly, financial factors. Poverty can prevent patient from affording medication. It can be the factor affecting the patient compliance. Secondly, non-financial factors. Lack of motivation, lack of information, difficulty understanding the instructions, poor communication between the doctor and patient, side effects, forgetfulness to take the prescribed drugs, complex treatment regimens, and duration of treatment. These these are the non-financial factors which affect the patient compliance. Thirdly, other factors: patient's health, beliefs, and lifestyle, education level of the patients, some patients which may be elderly, psychiatric diseases, and unstable family situations. These are the other factors which affect the patient compliance. Now, what can be the impact of cost of treatment in patient compliance? It can again be categorized into three parts, which are non-adherence, incomplete treatment, and public health implications. What is non-adherence? It is the high medication cost which can lead to non-adherence, where patients skip doses or delay refills to save money, worsening health conditions. Incomplete treatment. Expensive treatment plans may result in incomplete treatment when patient cannot afford their medication, leading to deteriorating outcomes of the health and reduced quality of the life. And thirdly, public health implication. Non-compliance due to cost can have broader public health implications such as increased risk of disease transmission. So, we can perform some strategies to improve the patient compliance. First of all, establish a strong doctor-patient relationship. Building a strong relationship between doctor and patient is very helpful, which can foster trust and open communication, which ultimately improve compliance. Secondly, educate and inform patients. Providing oral and written information, allowing patient to ask questions, and clarifying doubts are crucial for the patient compliance. Thirdly, patient-friendly packaging. Dispensing or packing the drugs in user-friendly packaging can make it easier for the patient to adhere to their treatment regimens. Now, how the patient compliance can be evaluated? There are 3 points. First of all, physiological markers. Physiological markers can be used to assess patient compliance, providing into the effectiveness of the treatment. Second, therapeutic drug monitoring. It is monitoring drug levels in the blood. It can help to determine whether patients are taking their prescription as per prescribed or not. And thirdly, medication containers. Asking patient to bring their medication container can be a easier way to access the compliance and identify any issues. These are the three factors which can be used to evaluate the patient compliance. Now, what are the benefits of improved patient compliance? There are three benefits which can be categorized. Firstly, better health outcomes. Improved compliance leads to better health outcome, reduced disease progression, and lower mortality rates. Secondly, reduced healthcare costs. Effective treatment compliance can result in reduced healthcare costs by avoiding complications and hospitalizations. Third, increased patient satisfaction. Patients who adhere to their treatment plans are more likely to be satisfied with their care and overall experience. So, this is all about the relationship between cost of treatment and patient compliance. Now, there are some resources for patients who cannot afford to adhere to their treatment, which can ultimately affect the patient compliance. So, these are given below. First of all, patient assistance programs. There are many pharmaceutical companies which provide free or low cost medication to the eligible patient, whoever find it necessary. Secondly, Pradhan Mantri Jan Arogya Yojana (PMJ). There is this Yojana, government sponsored health insurance program in India that covers hospitalization expenses for economically disadvantaged families. Jan Aushadhi scheme. It aims to make quality generic medicine available at affordable prices. Their prices are certainly lower than many branded drugs. And thirdly, Patients Welfare Association (PWA). It offers support for patients in navigating the healthcare system and meeting various medical needs. So these are some additional resources which can be again used for increasing the patient compliance. Thank you.